Hi, everyone, and welcome to our Prostate Conditions Education Blue Ribbon Prostate Cancer Talks, where we discuss the latest advancements in prostate cancer care. My name is Kara Clements, and I'm the Director of Patient Engagement and Development here at PCEC. Today, we're happy to have Dr. Brigitte Surferty here with us. Dr. Surferty is an associate professor at the University of Arkansas for Medical Sciences College of Pharmacy. She is board certified in both nuclear pharmacy and lifestyle medicine, and she teaches these subjects with a focus on improving patient care. Her expertise makes her the perfect person to help us unpack an important topic: PSMA PET scans for prostate cancer. Dr. Surfety, thank you so much for being with us today.
And thanks, Kara. I'm happy to be here and I hope it's helpful.
Perfect. As a patient navigator, I often hear confusion about the role of nuclear medicine in prostate cancer treatment, especially around PSMA PET scans. Most guys are familiar with the PSA blood test, but aren't sure what PSMA PET scans are and what sets them apart from that. I'm excited to talk to you today about this to help improve some clarity for men and their caregivers.
Yeah, I think it's a good idea. And I can imagine it is confusing. PSA, PSMA, what are all these acronyms? And so, as you know, PSA, prostate specific antigen, it's a blood test that can measure the amount of protein that's made by the prostate. And so, higher PSA levels can indicate that there's a potential issue with the prostate. It could be cancer, but it also could be something else. So, it could be some sort of inflammatory condition. So, high PSA might mean cancer. It might not. It's a very general marker. It doesn't show us precisely where the cancer could be or if it's spread.
Okay, so the PSA is just a marker that hints at the issue, but doesn't provide specific details on the cancer location.
Right. So that's where PSMA PET scans or PET imaging comes in. And so PSMA stands for prostate specific membrane antigen. And so all that means is that's a protein that's found in higher amounts on malignant prostate cancer cells. And so as you inject this PSMA radioactive tracer, when they're doing the PET scan, it's going to circulate and then bind to PSMA proteins on the surface of prostate cancer cells. And so it gives us an idea where those cancer cells are in the body.
Okay, so the tracer highlights those PSMA proteins, helping us see the cancer more clearly on the scan as to where it currently is.
That's correct. And so, from a how does this work perspective, once the tracer is injected by the nuclear medicine technologist, it's going to travel through the body and it's going to bind to areas that have these high PSMA levels on cancer cells. And so the injection itself just takes a few minutes. The patient stays in nuclear medicine for a period of time to allow the tracer to circulate and bind to those PSMA proteins. And then after that, the nuclear medicine technologist will position the patient under a PET camera and take the imaging. And so the radioactive tracer is really allowing us to see where those cancer cells are in the body. Are they confined to the prostate or have they spread somewhere else? And so the whole scanning process takes about 35 to 40 minutes. And then patients are going to be in the department for about 2 hours to do all of the preparation, the imaging, and then that waiting period.
Okay, that's great to know. So they can
Hmm.
expect about 2 hours
Yeah,
for the appointment time. And unlike the PSA blood test, which just gives the number, the PSMA PET scan actually shows the areas on the scan.
that's right. Yeah, so it's a much more precise tool, especially if men have a high PSA and they don't really know if it's cancer or something else. The PSMA image can find cancer spread in ways that some other imaging modalities might not. And so it helps to determine the extent of the disease. Is it confined within the prostate or has it spread elsewhere? Evidence of metastatic disease.
So I can see how that would be reassuring for men and their families, knowing that this scan can help pinpoint the cancer location more accurately. And I could see that it could be a big help in planning the next steps for their treatment.
Yeah, yeah, and that's why we do it. And so PSMA is helpful in looking at what are those options for treatment after we know if the disease has spread beyond the prostate or not. So PSMA PET is a real advancement in prostate cancer care. And so because it's so new, it's natural that there are questions about that. And I'm glad we're able to have this conversation about the process and also about how the drug itself works.
Yeah, thank you. I know in the big question, are there any risks or side effects from the tracer that's used for, is there something that patients should be concerned about?
Sure, it's a good question. So people hear the term radioactive and they get worried. And one of the things that's important to know is this is a diagnostic radiopharmaceutical. And so these are very small amounts of radiation, and it's used only to take the image diagnostically and not therapeutically. So we're just really just taking the picture using the radiation with the PET scanner. So patients don't experience side effects like you would think about from radiation. They're really just experiencing side effects of an injection if they have any at all. So there might be some mild irritation at the injection site. Sometimes people have a metallic taste, but if they have any sorts of concerns about that, they should talk with the nuclear medicine technologist as it's being injected, and certainly with their physician, their provider, as they're following up with that.
Awesome. Well, thank you so much, Dr. Surfety. I think this information and overview will help men and their caregivers feel more informed and definitely comfortable about getting a PSMA PET scan. I will encourage them to discuss this with their healthcare team if they're considering it, and hopefully they'll feel prepared and confident about having the scan done.
Yeah, I hope so too. And I hope it was helpful. Thanks for the
Yes,
invite.